Hi there. Welcome to the M&M Medical Clinic. My name is M. Hope that wait wasn't too long for you. No? Well, I'm glad to hear it. Well, thank you so much for coming in. My name is M, but no relation to M or M. What brings us in today? Okay. Yeah, we absolutely can get you sorted out here. Just give me one moment. I'm just going to need to look over your file real quick. No, our system is down today, so got to use the good old paper, it seems. Well, just looking at the report here, it seems that you haven't seen us in quite a while. So I'm just going to need you to confirm a bit of information with me, and then we'll get underway with the pre-exam, okay? Okay, sounds great. All right, so if I can find my pen. Right here. I'm just going to need you to start off by confirming your name and date of birth for me, okay? Alrighty, perfect. And then could you tell me, is there any current medical issues that the doctor should be aware of? Okay. All right. And could you please confirm, do you guys have any history of like cancer, diabetes, heart disease, anything of those likes in the family? Okay. Are you currently taking any over-the-counter medications or herbal supplements, anything along those lines? All right. So, do we have any allergies or medications that we're allergic to that the doctor should be aware of? All right. Okay, for sure. Have you noticed any changes in your appetite recently? Any trouble eating, keeping food down, stuff along those lines? Okay. All right. Any new or unusual symptoms prior to the visit? Headaches, dizziness, sore throat, lightheadedness? All right. Okay. How are we sleeping? Are we having any trouble staying asleep, falling asleep, waking up in the middle of the night, restlessness, anything along those lines? Okay. Any issues with your vision or hearing? We will be doing an ear and an eye exam as part of the pre-exam. However, we do suggest that you see your optometrist if there's anything a little bit more glaring, you could say. No? Okay, for sure. Are we up to date with all of our vaccinations? Flu vaccine, COVID-19, meningitis, anything along those lines? All right. And then, last but not least, just as a kind of final note, is there anything that I didn't ask you here that you feel should be explained to the doctor before he sees you? All right. No, that's perfectly fine. We want you to be thorough and We want to make sure that we're getting all the necessary information to the correct parties. Nothing's too small. Alrighty, and I think that just about does it for all my pre-questions. Now let's get into it. Okay, so first things first, we're just going to start off by taking your temperature, okay? So give me one moment here. I'm just going to put some gloves on, and then we're going to get into taking your temperature. Okay, now that our gloves are on, I'm going to just take your temperature now, okay? So let me grab my thermometer. Get it out of the bag here. All right, now I'm just going to put this under your tongue, okay? I'm going to have you hold it there for about 30 seconds until the beak blows off, all right? So I'm just going to have you open your mouth. I'm going to put this under your tongue. It might be a little cool, but I'll warm up really quickly here. All right, good. Now just hold that under your tongue for about 30 seconds. Now I'm just going to jot down some notes while we wait. No, you're doing perfectly fine. Just keep holding it in there. Oh, and there's our beep. Let me just grab that out. All right. No, and that is perfect. So you like to see. Great. Any questions? Okay. Okay, so next up, we're just going to quickly check your pulse. I'm going to try to take it in a couple of places. First off, I'm just going to need your wrist, okay? So if you could give me that. Thank you very much. All right. I'm just going to count the pulse beats. Just say very quiet for me, okay? 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, great, excellent. I'm just going to ask the other wrist now. Okay, thank you. All right, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, I'm just gonna real quick go back to the other wrist now, just to get my reading one more time, okay? I think my count was a little bit off. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, yeah, it just seems like my count was off on the other wrist. I thought there was an issue there, but no, absolutely fine. And last but not least, I'm just going to get your pulse right here up by your neck, okay? So I'm just going to ask that you please tilt your head back a little bit, okay? Perfect. All right. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. All right, perfect. No, it lines up excellently with your wrist pulse as well. Normal heart rate for adults is anywhere between 60 to 80 BPM a minute. Athletes who are constantly working out, they can get their heart rate quite a bit lower, somewhere in the 40s. your heart rate is well within that healthy adult range, so you have nothing to worry about there. All right, great. Okay, next up, I'm just going to listen to your heart, okay? I got my stethoscope right here. Okay, first off, I'm just going to put this on your back. So I'm just going to ask that you sit forward. Yep, relax out your shoulders. All right, deep breath in. And out. Deep breath in. And out. Okay, great. Just going to switch sides here. Shoulders straight. All right, breathe in. And out. Breathe in. And out. Breathe in. And out. Okay, excellent. Next up, I'm just going to listen to your lungs now, okay? So I'm just going to put the stethoscope right here on your chest. All right, same thing. Just deep breath in. And out. Deep breath in. And out. All right, other side. Deep breath in. And out. Deep breath in. And out. No, everything sounds great there. Just going to write something down real quick. Alrighty, no, you are doing excellently. Okay, so next up, we are just going to check your blood pressure, okay? I got my blood pressure cuff here. I'm just going to need you to roll your sleeve up so I have easy access to your arm, alright? Now, this is going to squeeze your arm a little bit, but it's completely painless. Let me just grab it out real quick. Alrighty. I'm just going to wrap the cuff around your arm. Alrighty. Going around your arm now. Make sure it's tightened. All right. I just want to get one more reading. Okay. All right, perfect. Next, I'm just going to take the cuff off that arm, put it on the other one. All right, going on the other arm now. All righty. Give it a bit of squeeze here. Forgot to tighten it again. Alrighty, one more time. excellent. Just going to write that down real quick. No, everything there is completely within normal range as well. No, excellent. Okay, so next up, we're just going to do a very quick and simple eye examination, okay? I have my nifty little pen light here. I'm just going to shine that into each of your eyes individually and see how those pupils react, okay? So, just look straight ahead at me. Don't follow the light. Now I'm just going to move it over to the other one. Okay. Good. Great, excellent. All right, so now I am just going to simply hold the pen light and I'm going to ask that you follow it with your eyes, but do not move your head, okay? So just follow with your eyes. Great. Doing good, doing good. Excellent. Okay, perfect. Next up, I'm just going to take my hands and I'm going to slowly move them into your periphery. I'm going to give them kind of a wiggle. Tell me just when you can see those hands wiggling, okay? Good. 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 Alrighty. Next up, I'm just going to cover one of your eyes and I'm going to shine the pupil or the light into them one more time just to see how those pupils react individually now, okay? So I'm just going to cover your eye. Alright. Good. Okay, excellent. And I'm going to switch hands, do the other eye. Good. Good. And great. Excellent. Okay, lastly here, we're just going to do a simple and quick ear examination. So once again, I'm going to use my pen light. I'm going to ask you to turn your head, and I'm just going to use this to kind of see down that ear canal, see if there's anything causing us issues, okay? Okay, excellent. So, pen light on. Please just turn your head for me. All right. Good. All right. Now I'm just going to ask that you turn your head the other way now. Okay. Shine that light in there once again. All right. Good. Good. Okay. So just from a simple visual examination, that doesn't seem to be any blocking the ear canal or any sort of issues that I can see just by looking at it. However, we are just going to do a quick test using one of our tuning forks. So I am just going to hit the fork here. It's going to make a sound. And I'm just going to pull that away from you ever so slightly. And I just want you to tell me when you could stop hearing the sort of humming, okay? So I'm going to hit it. All right, good. Now the other ear. Good. All right, we're just going to do that one more time now, okay? Say other ear. All right, good. And the other ear one more time. Excellent, excellent. No, last but not least, I'm just gonna, once again, hit my tuning fork. This time I'm gonna place it right here on your temple, and I'm not gonna move it. I just want you to tell me how long that you can hear that humming for, okay? So I'm just gonna hit it. Alrighty. And one more time, other ear, okay? Same thing. Just tell me when you stop hearing it. Great. No, absolutely nothing for alarm when it comes to your ears, just from our quick examination here. I just got some things that I would definitely want to jot down real quick if I can ever find where I put my pen. Perfect. All right. Excellent. All right, so that was our last test. I'm just going to jot down a few final thoughts, and then we'll get the doctor in here and get you on your way, okay? So. No, this is just the perks of doing paperwork, right? I hate when the system is down. Alrighty, no, I'm just so proud of you. I'm so happy that you handled everything well. You seem to be perfectly healthy. You're calm, cooperative, attentive during the whole process, so I really thank you for that. Not everybody is. Real quick, is there anything you would like to ask of me before I let the doctor know that he's ready to see you? Okay. All right, for sure. Well, hey, if you think of anything, I'm just going to be right outside the door here, so feel free to pop your head out and ask. I'm always available. I'm just going to go sneak out, talk to Dr. M out there, and let him know that you are ready. Thank you so much. You have a great rest of your day,